For this lab, we will be working on the pony specimen. First, we'll look at the skin incision for the forelimb, and then we'll work on some vessels and nerves in the proximal forelimb on the medial side. Then we'll move to the lateral side and look at some of the intrinsic muscles of the proximal forelimb. For the skin incision on this lab, you just want to make a medial skin incision on the forelimb. So you want to go from the mid forelimb where you made your first circular incision around the limb, go down the medial side across the carpus and down to about the mid cannon bone region, and then just reflect that skin off. So we're just going to remove that skin as one piece off the forelimb here. And then you want to re-identify your superficial pectorals before you start this lab. So we're going to look at the superficial pectorals here. So you have the descending part, is this little piece here. Then you have the transverse part of the pectoral here. And then you actually want to make a vertical cut through that transverse part of the superficial pectoral. And you want to bisect it basically in half so that you can split it open and see all the vessels and nerves running underneath. So here we'll open that up like that, and we'll look at some of these vessels and nerves in this region here. So here on the pony, we have the cephalic vein here that we identified in the previous lab. So you want to start there with this dissection and make sure you see that. Hopefully you have some nice injection like this pony has, where you will be able to trace and follow those veins. So here you have the cephalic vein coming down here, and it also is continued here. It's just kind of popping through this pectoral muscle. So we're just going to kind of work around that. So cephalic vein here, and then cephalic vein coming down this medial aspect here. So this is cephalic vein. Then we also have the accessory cephalic, so it's pretty small in this pony. But here we have an accessory cephalic, and then it kind of loses its injection. But it'll be fairly superficial, so it may come off with the skin, but that's okay if it does. So accessory cephalic vein, and then here you want to try and see the median cubital vein crossing over the medial side here to join the brachial vein. Then we'll move on to the artery that you can see from this view. So right here, you want to try and pick up this brachial artery and trace it as far proximally as you can. I know it's hard with the attached limb, but at least try and see part of it here coming down. So brachial artery, and trace that to the point where you hopefully will be able to find the common interosseous artery. So let's see if I can pull this up a little to elevate it. So here, possibly, we'll be able to see that artery kind of coming off and diving down. So my finger will be in the way just a little bit, but I want to pull this artery up and show you this common interosseous diving down in between the bones here. So that'll go in between the radius and the ulna, and you can actually use your probe and feel that there's bone on both sides of that artery, and it just kind of pokes through them, through that interosseous space. So common interosseous artery there. Then after that, the brachial artery will then change names and become the median artery. So here you want to follow that and trace it distally as we go along here. So you can either leave this flexor carpi radialis muscle intact and just work around it as I've done here, or you can go ahead and cut it and move it out of the way if you want to. But you want to follow that median artery and trace it distally, so you can pick it back up here. Median artery coming down, and then here we're actually reaching the point where you'll have the radial artery coming off, and then median artery will actually dive into the carpal canal here, and then becomes the medial palmar artery. So we'll go through that one more time because there's a lot of name changes there. So here we've got brachial artery starting up here, actually right there. Your common interosseous comes off and dives down. Then you have your median artery coming down, travels distally, gives off the radial artery here, going a little more cranially. Median will dive into the carpal canal, become the medial palmar artery, and then continue distally. So that's for the arteries. Then here alongside that artery, you actually have the median nerve. So same name as the artery, but median nerve traveling all the way down here. And down here it will actually become medial palmar nerve, but we'll cover that a little bit later. So median nerve coming down, so trace that with the artery. When you get to that carpal canal area, you actually want to identify this flexor retinaculum, which is this fascial sheath kind of that covers the artery and the nerve and holds everything in place there. So right there, it's that whitish tissue you see. It's very thick, so you actually want to make a vertical cut through that and open up that carpal canal. So then you can kind of pop up those deep digital flexor tendons that you have in the carpal canal. So once you pull those out, actually where my finger is then is inside the carpal canal. So make sure you can feel that and actually see that carpal canal space. So carpal canal, flexor retinaculum covers over and holds everything in place in that carpal canal. All right, and then we'll move to the lateral side and take a look at some intrinsic muscles. Now we're on a lateral view on the right side of the pony. So just for review, we have the trapezius muscle here, which has been cut and reflected. We have latissimus dorsi muscle here that's been cut. We have brachiocephalicus muscle coming up here. And then here we have that subclavius muscle coming up and over, which is part of the deep pectorals. So here you want to make sure you've cut and reflected your trapezius muscle. And we'll take a look at the supraspinatus muscle. So supra meaning above, and spinatus meaning the spine of the scapula, which is running right under the muscles here. So supraspinatus would be above that spine. So this is supraspinatus muscle here, filling that fossa in the scapula. Then below the spine of the scapula, so infraspinatus below, infraspinatus muscle is here. So here you run into a little bit of trouble trying to distinguish between infraspinatus and deltoideus. So they kind of overlap. Deltoideus overlaps infraspinatus here, and basically you just have to come a little bit more distally and kind of find the edges of deltoideus first and work your way up. So work your way proximally up the limb and kind of peel deltoideus off of that infraspinatus so that you can see the difference between those two muscles. So this part is all infraspinatus muscle, and then this part is all deltoideus muscle here. Just cut straight across and just reflect it a little bit, and then you're going to look at the triceps underneath. So you can actually reflect this part of deltoideus also. And we're looking at the lateral side, so lateral head of the triceps is right here, which I've dissected out from the long head. Long head of the triceps is always the biggest, and so it's this big muscle mass here. Long head of the triceps, lateral head of the triceps. So on the lateral head, you want to distinguish it and differentiate it by dissection. You want to reflect your deltoideus, go underneath, and as far cranial as you can, cut your lateral head of the triceps straight across. So you want to make that cut and reflect this lateral head of the triceps distally so that you can see this brachialis muscle underneath. So like I said in the carnivore, we use brachialis, we use the L in it for lateral. So brachialis, L for lateral, helps you remember which side of the limb brachialis is on. So brachialis is lateral. So brachialis muscle right there, under that lateral head of the triceps. All right, so then we have some of this antebrachial fascia. So this really thick antebrachial fascia that you'll want to incise and reflect. You can actually remove it and just take off big patches of it. So you'll just want to remove that antebrachial fascia. And we're going to take more of a cranial and medial view of the next two muscles. So you have extensor carpi radialis muscle, which is right here, coming down. And so we'll look at that from a cranial view. But we're also going to view the biceps brachii, which will actually be seen on the medial side. So now we're looking at a cranial view of the forelimb. So we'll review and go back to that extensor carpi radialis muscle. So you can see that extending down distally onto the forelimb here. So it goes over the carpus. So you actually want to trace this tendon of extensor carpi radialis and go over the carpus and find where it inserts on that cannon bone. So you're kind of coming down and tracing it, but be careful because you have this oblique tendon coming across of extensor carpi obliquus coming across here. It has several names, but that's one of them. So don't cut that if you can help it, but if you do, that's fine. But trace this tendon down and just see where it comes down on the cannon bone. So then we want to see the relationship between our extensor carpi radialis and our biceps brachii muscle. So here you have biceps brachii. After you reflect your transverse pectoral, you should be able to see your biceps brachii really well. So just make sure you've transected and reflected your transverse superficial pectoral and reflect it cranially. So then you can see this nice big biceps brachii muscle. So you can actually reflect the cranial part of brachiocephalicus and see the whole extent of this muscle. And you want to transect it in pretty much the middle of its muscle belly here. So then when you pull it down, you're going to see that it has this central tendon. So this part right here is the central tendon. And you can actually trace that proximally and see where that central tendon then, right here, so you kind of trace it up and goes up and over, and you can see how big this tendon, big and thick it is. This is the bicipital tendon, so you can see that proximally when you reflect the biceps brachii. And then distally, we want to reflect the distal part and trace that central tendon to what's called the lacertus fibrosus. So here I'll put the probe underneath it, but it's this attachment point. So it's a fascial tendon that goes across and connects your biceps brachii to your extensor carpi radialis. So here is that lacertus fibrosus elevated by the probe. So now we'll take a caudal view and look at two more muscles in the forelimb. All right, now we're looking at a caudal view of the forelimb. So for these muscles, you actually want to kind of palpate on the back of the limb here and find where your accessory carpal bone is. So that's that bump at the back of the carpus. And what you want to note here is that these two muscles that we're talking about make this V shape here and insert on the accessory carpal bone. So these two muscles are what we're looking at. So you're going to have to incise and reflect more of that really thick antebrachial fascia and kind of dig those muscles out of there. So the first one we want to look at is ulnaris lateralis. So here on the lateral side of the forelimb is ulnaris lateralis. So you want to differentiate that. And then the other side of the V, here on the medial side, will be flexor carpi ulnaris. And that you can appreciate that it has this little tiny head that's an ulnar head and then a really big fleshy humeral head, but both of them are part of flexor carpi ulnaris. You don't need to differentiate the two parts. So those two muscles, the flexor carpi ulnaris and ulnaris lateralis, make this V shape that insert on the accessory carpal bone. However, you do not want to mistake this little tiny deep digital flexor. This is the ulnar head of deep digital flexor. So it has this long tendon that goes down in this V. So don't mistake that for one of your muscles. And then there's also the ulnar nerve that goes within that V also. So be careful of that and make sure you don't cut that. So when you're doing this dissection, just be aware of those two things in the V shape.